The following segment is presented by Bremo Pharmacy.
I'll bet when you hear the word osteoporosis, you think that's something that only the elderly need to worry about. But the fact of the matter is, all of us, regardless of our age, need to be concerned about our bone health. Ann Anderson is here from Bremo Pharmacy. And is it true that by the time we reach 30 years of age, our bones have reached their maximum density and strength?
They have. What you do is in your teen years and in your 20s, as far as your intake of calcium, is very important because 98% of your bone mass is formed by the time you're 30 years old.
That's amazing. What exactly is osteoporosis?
Osteoporosis is a disease that's marked by weak, fragile bones that lead to fractures or a stooped over back, that type thing.
Now, who is at the highest risk of developing this debilitating disease?
Primarily women. 80% of osteoporosis sufferers are women. White women, Asian women. Over the age of 50, 1 out of every 2 women has osteoporosis.
1 out of every 2 over the age of 50?
Of women, and men, 1 out of every 8. You usually think about it as a disease associated with women, but men are also affected by it too.
Those are some scary statistics. Let's talk about the importance of screening then for osteoporosis.
Screening is very important because only by knowing your numbers and your bone density can treatment get started early if it's appropriate. And unfortunately, sometimes the first sign of osteoporosis is a fracture. So it's very important to get screened and to know what your bone density numbers are.
Every Friday in March at Bremo Pharmacy, the Staples Mill Road location, they're doing free screenings for osteoporosis.
Yeah.
Tell us a little bit about that.
Very simple, painless. There's no radiation. You come in, all you have to do is remove your shoe, put your foot on a machine, and your bone density is measured in your ankle. They'll give you a score called a T-score, which compares your bone health to the health of a 30-year-old. Combine that score and the reading with the questionnaire that a pharmacist fills out with you to help identify your risk factors. And you can leave with that information and take it to your doctor, who can then decide if treatment is appropriate for you.
So the pharmacist actually takes the time to sit and discuss with you what those results were. And it's just the ankle going in, so it seems very painless.
It is painless, and it takes less than a minute to do the actual screening on the machine. It's very quick.
Bremo Pharmacy definitely dedicated to our bone health with those free health screenings for osteoporosis every Friday at the Staples Mill Road location, and every Friday 20% off of calcium products.
Yes, because that is a very important part of treating and delaying osteoporosis.
Start taking that calcium right now.
Absolutely.
And speaking of medication, if you're having some problems with your current medication and their current doses, you can talk to a Bremo pharmacist about compounding. So we hope that you will do that. Talk to the pharmacist about compounding and those free health screenings at any area location for Bremo Pharmacy, or just go online to bremorx.com.